By now you have heard about Experienced Fractional Medical Affairs, and you are interested. What matters to you now is how EFMA actually performs in real operating environments. The following examples illustrate how companies have deployed EFMA to solve high-stakes medical affairs challenges with speed, quality, and flexibility. In one organization, an unexpected safety signal created immediate cross-functional pressure. The company needed senior medical judgment quickly, but did not have the internal bandwidth to manage the situation at the required level of rigor and urgency. A full-time EFMA leader stepped in on a short-term basis to stabilize medical governance, align the safety narrative cross-functionally, and support interactions with internal and external stakeholders. Within weeks, the team had clear decision pathways, consistent scientific positioning, and restored executive confidence, without the company having to permanently expand headcount. Another company recognized that its publication strategy was noticeably disconnected from corporate and brand strategy. Rather than hiring a permanent publications operational leader for this one-time project, they engaged 2 EFMAs who established a formal publications committee, including roles and responsibilities, defined decision rights and accountabilities, and built fit-for-purpose SOPs. The EFMAs implemented governance structure, improved cross-functional coordination, and elevated publication quality and compliance. When the organization later scaled, it inherited a mature, audit-ready publications capability, strongly driven by strategy instead of needing to retrofit structure under pressure. For early-stage biotech companies, the challenge is often different. Medical affairs capability is needed, but because every hire carries significant financial and strategic weight, they must carefully deliberate each addition to ensure the timing and scope are exactly right. In one case, a startup engaged an EFMA for just a handful of hours per week. During this phase, the EFMA provided senior medical input on scientific communications, early KOL interactions, and protocol development. This allowed the company to make high-quality medical decisions while preserving capital. When the time and money came to hire an in-house CSO, the strategic foundation was already in place. Leadership transitions can create significant risk if medical affairs continuity is disrupted. In one organization, the vice president of medical affairs departed unexpectedly during a critical period. An EFMA executive stepped in immediately to maintain governance, support the executive team, keep morale and motivation high for the medical affairs team, and ensure external engagement continuity while the company conducted a thoughtful search for the permanent hire. The result was zero strategic drift, preserved stakeholder confidence, and a far less pressured recruitment process. Across these examples, the pattern is consistent. EFMA is not a one-size-fits-all solution. It is a precision tool that allows organizations to introduce the right level of medical affairs leadership, governance, and strategic rigor exactly when it is needed. If your organization is navigating complexity, transition, or growth inflection, EFMA may provide the flexibility and senior expertise you need without overbuilding at the wrong time. Connect with LMA to explore how Experienced Fractional Medical Affairs can support your next phase of success. Get matched to your own EFMA today.